Well, they are a big sexual concern. Why? Because remember, we are fighting against HIV, and through these sexual violences, people are getting HIV. That's one. Number two, unwanted pregnancies. One years unwanted pregnancy, and usually, it's very difficult. Some people, they don't report these cases, and then one will carry through the pregnancy until delivery, but they always be hating this pregnancy. They would always be hating the child, hating as in they don't like to see the pregnant, they don't like to see the child, is means it's trauma. They are reminded every day of the sexual violence through that pregnancy and the child that grows up from there. And then you also look at other sexually transmitted infections, for example, chlamydia, gonorrhea. All these infections, they are a common cause of infertility among women in Africa, among women in Zimbabwe. So that's why we're very much worried. So usually it's the young girls. It's usually the young girls, and this is the perpetrators are usually the relatives or the people who have a relationship somehow with the child. It's rarely do we get these cases from. It's uncommon to get these cases from strangers. It's usually from the people who are around that particular victim. Well, the impact is very big. It's huge in that we only have 72 hours medically that we can intervene when someone has been sexually violated, if has been there's been sexual violence, rape, or something like that. We only have 72 hours to intervene in terms of preventing HIV, in terms of preventing unwanted pregnancy, things like that. So those are life-changing, conditions in someone's life or experience in someone's life. So within 72 hours, at least we can prevent the pregnancy, we can prevent the transmission of HIV, and that is. But for some reason, like I've said before, the perpetrators are usually the relatives, the friends, family members, the people who are around that particular victim. So there are always deliberations whether they should go to the hospital or not, and things like that. And by the time that one relatives who comes in, and they come from somewhere, and they say no, they discover the symptoms of the patient. Then by the time they want to bring the patient to the hospital, it will be out of those 72 hours. So it's tricky there, but the encouragement is the teachers must help, because they are with their children always, and they must be trained. They must know the symptoms that there's been some sexual violence on this particular child. Church leaders, they must be involved. Neighbors, they must be involved. Community leaders, they must be involved. All those people have to always be looking around to be, they must be vigilant and be alert to be knowing the symptoms of someone that could have been sexually assaulted.